In August 2024, the FDA approved epinephrine nasal spray, branded as Neffy, for the emergency treatment of severe reactions in adults. 1 year later, experts talk about epinephrine nasal spray's access and impact.
The feedback has been very positive so far in terms of patients who were surprised at how rapidly it worked, which really shouldn't be a surprise. Epinephrine is a rapidly acting drug, but I think with the new device, they were, wow, and some of the observers were very surprised to see how fast it really works. Patients responding within 90 seconds, which is fantastic. And the patients had asked for a prescription for Neffy leaving the office after using it. So that's pretty good. It's a small sample size. There'll be more data that get presented and put out on that over the years. They do more offices with this program, but the user experience has generally been pretty positive.
Epinephrine nasal spray was approved for adults on August 9th, 2024, and for children on March 5th, 2025.
The FDA approved the intranasal self-administered epinephrine option Neffy down to the age of 4 years old, and for kids 33 pounds up to 66 pounds, which is equivalent to the junior dose of self-injectable epinephrine, is 0.15 milligrams. That dose is going to be 1 milligram.
Epinephrine nasal spray has provided an easier way for teachers to administer epinephrine to their students.
Well, I think that really what's important in terms of the prevention of allergies and then having immunotherapy for early allergies is that this really will open up which parents can go to work, which kids can go to childcare, what kids will be like at school, and really set that trajectory in a positive motion, because this is one major risk that kids have that will be somewhat muted as we find better solutions.
Before epinephrine nasal spray, the fear of needles delayed life-saving treatment. Parents hesitate. School staff hesitate. Even trained adults pause in critical moments. However, food allergies are on the rise, with a 50% increased prevalence since the 1990s. Approximately 33 million people in the U.S. have a food allergy. Needle-free options are reshaping the future. However, new therapies can be slow to become accessible for those who may benefit.
So, this is a product that's just approaching its first full year of approval and being available on the market. So with everything, there's always an expected ramp up. But I think coverage has been really good. Initially, it was always available through a program called BlinkRx, which is a mail order pharmacy, but it's increasingly over the past couple of months been available in more and more pharmacies, and they're building out that portfolio when I talk to their markets team. In terms of cost or whatnot, this is always dependent on what your plan is, and that's not exactly a straightforward question, but they do have a couple of things. So out-of-pocket max, if you were just going to pay cash for this, it's about $200, which is very competitive. Some insurance prices, you might be paying that. And then in terms of, depending on your insurance, there is copay reduction. That could be as low as $25, again, depending on your plan, depending on your area. We have not clinically heard of too many rejections. We've had to put through some prior authorizations, but that's sort of par for the course in terms of a new drug, and each quarter that gets better and better. But I think it's out there for patients who would like to try it by prescription, and I think it's not at a barrier level that we haven't seen with other drugs, new or old. Epinephrine is one of those things where sometimes payers make it quite difficult to get access to it, for affordable prices or whatnot. So this is something as a practicing allergist that we're always used to.
It's been a value added, especially thinking of patients that need a needleless-free version, specifically for severe allergy or anaphylaxis concerns. And I think creating more awareness of having a needle-free option is really important, especially for patients that might have that highest risk. And we've seen an expansion, especially in those pediatric patients or patients that are 15 kilograms to 30 kilograms. So starting to see more expanded use, more patient familiarity with the product. And I think ultimately that's going to drive a lot of relief for patients, especially those that might have needle phobia or have a reason why an EpiPen is really not the best fit for them. I would say, this is still a medication where there are some barriers, some payer concerns, right? And they're trying to be good stewards compared to an EpiPen versus the nasal epinephrine. But if you provide good documentation and really create good awareness around patients that may not be a good fit for epinephrine or an EpiPen, I think it is a viable option. And so, providing that documentation, getting through some of those prior authorization requirements, and I think too, as it's on the market more and people have more familiarity with it, we're hopefully seeing more and more adoption and access among some of the larger payers. I think, with payers, they're trying to create some criteria of use. And so I think the best way is to really provide good justification of maybe why a needleless version might be important for that patient, why there might be some needle phobia that be associated with it. And, it's very small. It's easy for patients to carry around. And now that there's a dose and approval for those that are 15 to 30 kilograms, I think providing that documentation from the provider to the payer helps get better access for those patients. And then they have a prescription or have that medication available for them for more of that long term.
In its first year, over 25,000 patients received prescriptions. Over 4,000 prescribers have written for it. Copay support has brought costs down to as low as $25, making access more attainable. In clinic, patients have reported symptom relief in as little as 90 seconds.
In terms of cautions, it would be nothing that's different than prescribing any other form of epinephrine. There are certain class effects you have to be concerned about, like if somebody has underlying heart condition or whatnot, you always have to be cautious in sort of advising patients about that. But if somebody needs epinephrine, there is no substitute drug. So that's something that you sort of have to accept in terms of prescribing. So nothing that I would feel is too much of a barrier to use or whatnot. The one thing that a patient may need to get used to if they use other nasal sprays, you can't prime this device. It's got one dose in there and it pushes up. If it's something like fluticasone or other nasal sprays, sometimes you pump to make sure that because it's got a little you gotta have a cord going into the liquid to get the pressure to come up. And neffy's built differently than that, so it's a single upward plunge. But other than that, it should be pretty easy to use. And again, it's just the sensation of something going in your nose as opposed to going elsewhere. And that's a trade-off that I think a patient, it should have the right to make. One of the other things that the company cautions about would be that for a couple of days to even a week or two afterwards, because of one of the chemicals that's in the solution that helps increase the speed of absorbency, it may make you prone to other things over the next couple of days to weeks, going in a little bit faster. But really, it's not much that I can think of. Again, I have venom allergy. I carry this myself. I haven't had to use it yet, but I would have no hesitation. And as a physician, even we don't like needles. So I mean, this is great. It's as minimally invasive as I think an epinephrine device can be at this point. So again, should I ever need to use it, I'm not going to hesitate to, and I hope my patients make the same decision. But it's up to them. We just that the epinephrine that they're going to carry with them is the right one to prescribe. And, if they're telling you that I don't like needles, I'm not going to inject, I'm not going to carry it, you're prescribing something for them that they're not going to use when they potentially need it. And that sets up a lot of potential for unnecessary morbidity related with anaphylaxis.
That in late of 2023, December 2023, the anaphylaxis management guidelines from the allergy societies came out and updated their recommendations for out of hospital management of anaphylaxis, such that patients who administer self-administered epinephrine for symptoms including systemic hives and vomiting don't necessarily have to call 911 or go to the ER. And that's especially relevant for daycares and schools, but also parents. And the goal there was to realize that most patients who get treated with self-administered epinephrine improve very quickly, and that going to the ER is not absolutely necessary in all cases, such that requirement or recommendation for all patients to use one dose of epi, then you have to go to the ER, actually created a barrier. Yeah. And an additional barrier, not just from the needle perspective, but also a barrier that made people say, well, it's not that bad, I'm just going to manage it at home. I'd rather not give the epi. And I would have patients come in to see me, and the kid had eaten a peanut. They had hives all over their body for 3 hours, vomited for about 30 minutes and couldn't breathe for an hour. And in that case, the reaction eventually got better. And when I asked him, what made you feel like you didn't want to give the epi? Well, I didn't want to give the epi because I didn't want to go to the ER.
Needle-free options are reshaping the future, making early intervention easier and adherence more likely. Neffy is just the start.
Needle phobia is a big thing, and that's why Neffy and the other drugs that are in the developmental pipeline that are needle-free are being developed to help address that. It's a little too soon to tell sort of some of the use patterns, but there's a general thought that if you take away the inertia from injection, that patients will start to use this earlier in the cascade when they start to see the emergence of maybe the first severe symptom, as opposed to waiting for 3 or 4 of them to arrive and delay, past 9 to 15 minutes or whatnot, just sort of going through the mental motions of, do I use this? Is it severe enough or whatnot? So those are data that we hope to see over the next year in terms of more feedback. In terms of its portability, that's another thing that will come out in the next year. I mean, this is a very, very small device. It fits literally in the palm of your hand, the individual device. As the twin pack, it's maybe a little bit bigger than the palm of your hand. It comes as a 2-pack, but the individual device is small enough to fit in the palm of your hand. When carried as a twin pack, this is still maybe slightly bigger than a cell phone or whatnot. And it comes, you can order a carrying case from the company with a carabiner, can clip right onto your bag or whatnot, or fit in your pocket, but it's designed for portability. It's robust to temperature in terms of it can tolerate heat excursions up to like 122 degrees Fahrenheit. And it's also robust to the cold as well. So it's good in terms of like an active child or an active adult with an allergic condition that needs to carry epinephrine with them. It doesn't have a window on it. It's protected. Like the other forms of epinephrine tend to have a clear window where the epinephrine is actually technically degradable to light or whatnot with exposure. So I mean, this is a pretty durable product. It was designed with the portability and lifestyle in mind from my discussions with the company. It's great. Every device has gotten smaller over time in terms of the evolution of the products, and this is now the smallest, most portable device.
I think the biggest question that people have is, Neffy got approved without any real clinical data. There's PK, PD data, which is the same for all the injectable products. And now what clinicians want to see is, does it work in practice? And there was just a study that we got accepted in the Annals of Allergy, Asthma, and Immunology. And I think that came out of ARS's effort to get clinicians familiar with the product and comfortable with using it. So basically what they did is they gave healthcare providers free samples. And they asked afterwards, did you use it and how successful was the use? And it turns out that 486 patients were successfully treated with a single dose of Neffy, and another 59 required a second dose but were successfully treated. So if you look at that, that's approximately 90% of people that received Neffy responded with a single dose. This is almost identical to the numbers that you see with injectable epinephrine. So I think that data, along with some smaller studies and case reports that are coming out, will make clinicians a lot more happier.
There is one product from Aquestive, which is a sublingual epinephrine film, where the company has submitted their data to the FDA for review for potential approval. So that's probably the next thing that we could potentially see on the market. The company's supposed to hear that decision by, I think, the end of January or whatnot, and there may be an advisory committee like there was for Neffy where they reviewed the data and a panel gets asked questions or whatnot. The rest of the products on the market are different forms of intranasal. I think there's another sublingual. It's not a film, but it's drop based. So yeah, I mean, I think the the pharmaceutical industry has recognized that this is a drug that certainly could benefit from evolution. neffy was the first device to answer that call, and there will be others moving forward. But with more choice, that again only increases the chance that you're going to find something that your patient is actually willing to carry and use. And really that's all that we are looking for in a prescribing decision.
I mean, the greatest thing is we're trying to be very patient-centered, right? And I think the more different routes of administration we have, the better it is going to be for patients. So we talked about that intranasal epinephrine. I think that's added a lot of value to patients, but I think having something like a sublingual at the same regard is also important. And so it enables, a patient to have really that preferred dosage form and route of administration on hand. And therefore we can reduce those anaphylaxis, reduce any of those unneeded hospitalizations, and give patients that security. And I think sublingual will really expand that armamentarium of treatment options.
For clinicians seeing a patient who's at risk for anaphylaxis or any type of severe allergic reaction, I think we really do need to ask the tough questions about, are you really going to carry this with you? Are you really going to use it? And figure out what the barriers are. We can tailor now what we prescribe to them. Some may prefer the older auto injectors for whatever reason. Some may prefer the new devices. That's the nice thing. We have choices now, and we can align this with their preference. So that again, when that person, hopefully it never happens, but they need to use epinephrine, they have something that's with them and they're going to use, and that's going to decrease, the risk of hospitalization, the risk of other bad outcomes or whatnot. And it's going to make the reaction go away early. The earlier you treat this, the easier it is to deal with. So devices like this only help us, and I think it's great that the market is seeing this as a need, and ideally there'll be additional products out there to give choice. But right now we have a great alternative to an auto injector, and this is something that I think physicians should be talking to their patients about. I think we need to get awareness that there are choices now. Most prescribers may not know that. So it's first year of the life cycle of the drug. It does take some time to implement or whatnot, but the allergy community is certainly excited about having this alternative.